All right. Good afternoon, everyone. Good afternoon, everyone. I hope we're having an amazing time with the Amwe, the third edition of the All African Medical and Wellness Expo. Hope we're having an amazing time. Please, if you are doing that, can we give a round of applause to the organizers of this program? Wonderful one. Now, if you're still here today at this point, I'd like everyone to please kindly take their seats. Please relax. The conference is starting properly now. What we had earlier was the opening ceremony. So we're going into the main deal. And I want everyone, please, this is a time for you to take out your conference materials, your papers, your pen, jot as much as you can, because this is a time for us to go into proper negotiation dialogues on how we're going to make medical tourism a reality. So you're welcome once again. So, yes, ma, you can come up. Yes, you've been called. Yes. Please, can someone kindly help her get her seat? That's Elizabeth. She's supposed to be on the panel. All right, so while we're doing that, I will quickly reintroduce myself, and then our panelists quickly introduce themselves properly, their background, so that we know where we're coming from, and then we'll take it up from there. So my name is Ambassador Tina Kenechukwu. I'm a business consultant, and I'm also a TD presenter, and I'm the moderator to this very particular panel, and I'm also a medical tourism expert. So I will start by my left, sir. You have your microphone. Please go ahead. Yes.
Thank you. Good afternoon, everyone. My name is Dr. Ayodele Cole Benson. I am the chairman of Ecolab Radiology and Laboratory Services, but I'm also the team lead for Health as Business Thematic Group at the Nigeria Economic Summit Group Health Policy Commission. Also the first vice president of the Healthcare Federation of Nigeria. Thank you.
Wow, it's a pleasure to have you on board. A round of applause. So we'll have the next person. Microphone, sir.
Oh, sorry.
Yeah.
Good afternoon, everyone.
Yeah, good afternoon, sir.
My name is Solomon Yakubu. I'm a healthcare facilitator, a writer, and also a continental voice in healthcare mobility and transformation. I'm also a co-founder of Amwe Medical Awareness Foundation. I'm delighted that we're all here on this altar of this occasion. Thank you for coming.
You're welcome, Mr. Solomon. Thank you.
Thank you, moderator. Good afternoon,
Good
Excellencies.
Afternoon.
My name is Ngozi Azodo. I'm a medical doctor, a global health expert, a policy person, and I advise the Abia State government. I'm a special advisor to the Abia State government, and currently also coordinating several global health projects. Thank you.
You're welcome, ma. Doctor, it's a pleasure to have you. You're welcome, ma.
Good afternoon, everyone. I'm so sorry they were interviewing me outside. I didn't realize it was time. My name is Elizabeth Audu Lawrence, and I am a trauma stress care practitioner. I'm representing mental health here today, and I'm happy to be here. And I'm also the founder of Zen Hub Mental Health Initiatives. Thank you.
Well, you're welcome, Elizabeth. It's a pleasure to have you on board. All right, so thank you so much, everyone. You can see the amazing people you have on the panel today. And permit us to stand on the existing protocols. Now, to start this panel session, we're going to be discussing, the panel topic says, observe, learn, correct, and grow. Observe, learn, correct, and grow. So we're going to be taking some questions here, and then the panelists, the question will be thrown to each of the panel, to a panel member to share from their wealth of experience. Now, what do we hope to achieve from this very topic? Now, even me, myself, when I saw this topic, I was set aback. I was like, what do we want to achieve from this? But by the time I was able to go through it, I realized that this is one of the biggest topics that we need in this very particular meeting. The purpose of this particular topic and discussion is to also help us to understand how healthcare can improve by listening and then learning what other countries are doing, and then also taking, learning from them and then putting that into practice. That is why we say observe, learn, correct, and grow. There are countries that have gone ahead when it comes to medical tourism. So many of us, there's so many school of thought to also medical tourism. Some people also believe that medical tourism is when we talk about traveling out of the country. Today, you are going to learn what exactly is this medical tourism we're talking about. And as you are living here as a participant of this conference, you are going to now understand that even that organization you are representing here today, whether it's an NGO, a hospital, you realize that even you people can also benefit from the medical tourism. From what you are going to learn from this panel, you take it back to your organization, you put it into practice, and then all the money, going around in the medical tourism, part of this can also come to your organization. So that is what we hope to achieve. So we're going to take start by taking some of the questions, and then I will start with the first question. So the first question says, now we've been hearing about medical tourism. Now when we talk about medical tourism, I want us to have a proper definition of medical tourism first of all, before we now start taking questions from him. So from a layman's point of view, from a layman's understanding, what is really this medical tourism we're talking about, and what are the aspects of this medical tourism that people need to understand before we start discussing the intricacies in it? So I will start with me, sir. Please, let's start with you. Can you, from a layman's point of view, what is this medical tourism we're talking about?
Yeah, thank you. I think medical tourism is, simply put, that journey you make outside of your place of abode simply for the sake of obtaining health care at your destination. Okay, so it could be within the country, which is in-country medical tourism. It could be outside of the country, which is outbound medical tourism. So any of those journeys that you make, principally to obtain healthcare,
quality healthcare,
as part of your objective, that's medical tourism.
Thank you. So any journey you make to obtain quality healthcare is medical tourism. Please, do anybody have to add to this? So I hope your understanding is beginning to open, because when people hear about medical tourism, you think it's flying out, flying in. You need to understand, when you move from one point A to point B, there's already tourism taking place. Please go ahead, Mr. Solomon.
Thank you, too. Medical tourism has to do with traveling from one country to another in the quest for healthcare or quality and specialized treatment. Now, medical tourism encompasses three concepts. So that, because anytime mention is made of medical tourism, what comes to mind is only outbound medical tourism. People going out only. And medical tourism goes beyond that. It encompasses three concepts. We have what we call outbound medical tourism, which has to do with the common definition of medical tourism we all know. Anytime the name is mentioned, our mind is people are going out of the country. And that is why most of the time you see that people try to kick against it. You hear words like, we are going to revise medical tourism, simply because they have narrowed or limited the understanding. Secondly, it has to do with inbound medical tourism. People can equally come from outside countries to your own country if the facilities needed are available. So it's not limited to going out alone. People can equally come from outside. And the third one is intrabound medical tourism. It has to do within a country, from one local government to another local government, from one state to another state. In this case, it does not require international boundary. There's nothing like crossing international boundary. So this is what I can tell you about medical tourism. Thank you.
Wow. Thank you so much. Let's have Doctor add something to it, ma. You can go ahead, ma.
Okay, thank you very much. Medical tourism is tourism for
Tourism,
for
beautiful.
purposes of healthcare. So if you are traveling from your country to outside or inbound, it's medical tourism, either outbound or inbound. Now, for us as a country, what we are concerned about is the outbound medical tourism, and that's why we have these conferences. We want to reverse outbound medical tourism to inbound medical tourism for several reasons. Number one is that outbound medical tourism undermines our own local facilities and infrastructure. It undermines or depletes our foreign exchange. And it also, helps to take away our healthcare workers. So, as a country, we are concerned about outbound medical tourism. And so, what we are here to do, I believe, is to look at how can we...
It's to bridge the gap. We're here to bridge the gap.
Well, that's the English.
Yeah.
So I'm now explaining what that bridging the gap is, which is how do we make inbound medical tourism the priority? How do we strengthen our facilities to ensure that people come here to seek for medical attention? A time there was when even the king of Saudi Arabia used to come to Nigeria to receive health care. So we want to go back to that time. And that also means that we're not going to be behaving or working as if we're in a vacuum. We're working in a world where there are already standards. So for us to reverse that, we have to attempt, to best the existing standards and quality of service. And that's where government comes in. Thank you.
All right. Thank you so much, Dr. Ngozi. But if I'm to throw more light to what you said, a lot of people like to use the word reverse medical tourism, because if we say we want to reverse it, that means we want to take away that tourism completely. For me, it's about not necessarily reversing it, but for us to bridge the gap. How do we benefit from outside the country, and how will they benefit from us? It's just like opening more doors for more collaboration, instead of having us going out or having people going out. We, just like you said, we have wonderful things here that people can benefit. So medical tourism can also mean, just like we have our foreign delegates here, it's tourism. They are on a medical tourism journey. Just like you said, any tourism that involves healthcare, that is it. So, and they have been on different medical hospital to hospital visits. That's already tourism. So how do we bring in? What about people that cannot be able to travel? Or how do we also partner? So the gap is more like bridging collaboration. For me, I really don't think we should reverse completely, but we should open up more for collaboration, bring in where necessary, and then travel where necessary. What do you have to say about it, Ma? Because I can see you grabbing the mic.
Okay, thank you very much. I think these are semantics. Medical tourism, which is of concern to us, is the outbound medical tourism. If the whole world is coming to Nigeria to receive medical care, we'll be happy about it. We will just focus on improving our health system and increasing our capacity to address those issues. So what we have now is more outbound health tourism,
Yes.
where we Nigerians are going outside to seek for medical attention. And we are saying we want to stop that.
And strengthen what we
We
have.
want to stop that. We want to stop Nigerians from going outside to seek health care, and also increase the foreigners from coming, desire to come to Nigeria to seek medical tourism. So one is reverse, the other one is increase.
Please, thank you.
Thank you.
Thank you. I think it's well balanced. Please, can we give Doctor a round of applause? That's a beautiful one. Thank you so much. All right,
Okay.
Elizabeth, let's hear from you. Thank you.
Okay, my definition of medical tourism is very simple. And I think the first doctor or the first speaker said it can also be foreign and local. And medical tourism for me is people travel to a facility for medical attention because they believe or they perceive that that place will give them a better they'll give them better services, more advanced services, more care, For example, I can recommend, if someone recommends me going to India and say, oh, I've been to India and this happened and this happened, I would go there based on what the person told me. And I think for us in Nigeria, it was while sitting down today, and I was like, oh, I'm also in Abuja and I'm also practicing medical tourism. I live somewhere in Jabi, and sometimes I have to go to the Naowa Hospital, which, by the way, is a very good hospital, which was recommended to me, and I've been there. I will travel all the way, and I prefer to go there for whatever services I need. And it's so interesting to know that a lot of us, the problem we have is we don't do enough research. We don't, or rather, there's no information that is being passed around. I'll give you an example. How many people know that in Gwarimpa General Hospital, they do free surgeries for people that have obstetric fistula? Wow. Nobody knows that. Wow. They do free surgeries like every two months, and that is because they are working with an organization. And how did I find out? I was talking to someone that lived with it for years, that even went abroad for treatment and it failed. And she had to come and do it here. And guess what? It worked. And Nigerian doctors were the ones that worked on her. I will give another example. Years ago, my father was stabbed. And I was telling someone, he was operated here in Nigeria. He was stabbed, he almost died, but he was operated here in Nigeria and he survived it. So I think most times we just have that notion that we have to go out of the country before we can get that service or that medical attention we need. But it's so sad that most of our very good hands have left the country at this point, but we have to find ways to attract them back, to bring them back home. Yes, thank you. Because even if you go abroad, they're the ones working there.
Wow, thank you. All right, okay, let's start with Dr. Ngozi. Let's have you, yes.
I think that medical tourism has a definition. We need to be careful not to stretch it too much. Medical tourism is inbound and outbound.
Yes.
Now, the way health systems are organized, they're organized in such a way that you should not be able to get everything you need in your community. That's why we have primary, secondary and tertiary. Yeah. So you leaving your community to go to seek secondary care is not tourism. Okay, so let us focus on what is important and useful for the purposes of this conversation. We are looking at outbound and inbound. Leaving my house, my primary health facility in my village to go to Amwe to get tertiary care is not tourism. Please, thank you.
All right. Thank you. Go ahead, Mr. Solomon. Thank you.
It's all right. We are here to observe, to learn, to correct, and grow.
Yes.
So let's call a spade a spade. Medical tourism has to do with once you leave where you are residing to another place. It can be to another country, within your own country, provided you are going outside your own place for Medicare. Is medical tourism. Anyhow you want to look at it. There are problems already. I don't need to shy away from the problem. We cannot end medical tourism. What we can put an end to is medical evacuation, where people are going outside. They are just going outside and there's nothing to be done to bring them back to their own country. So the choice is ours. What people are looking for outside, if you don't want them to go, it's simply in your hands. You can also provide what people are looking for, the demand side of healthcare, specialized treatment, quality treatment. These are things that move people out in the first place. Once you have this in place, it becomes a choice. You don't even need to tell somebody, I'm not going out. Don't go out. You cannot.
Okay, so Mr. Solomon, sorry for cutting you because of our time. I think there's a missing link there. So people need to properly be clarified. From what Dr. Ngozi said, she said that owing to the way the hospital operates, the primary health care, the secondary and the tertiary. So when people move from primary to secondary to tertiary, probably it's simply referral.
It's referral.
So for her, that is not medical tourism, it's referral. But when people move maybe from one destination to another, maybe outside the country or inside, that is when it is medical tourism. But you are saying that from one location to another location. So I need us to clarify this thing. What is the difference between medical tourism and referral? So I don't know. Do you want to say something before Doctor is raising up? Okay, please. Sir, you can go ahead, sir.
I think there's no need for ambiguity.
Yeah.
Let's start with tourism.
Yeah.
All right. If I leave Abuja and I go to Calabar, because in Calabar there is a certain quality of care out there that is not available in my domain here in Abuja, or I don't like the standard here in Abuja. Ordinarily, I don't have any other business going to Calabar. The only thing taking me there is because I'm going to seek better health care. That's medical tourism, even though within the country. Okay? Now, in that place, most likely I'm going to check into a hotel. Most likely I'm going to, at the end of my treatment, do some site visits and all of that. So that's tourism of some sort. But I don't think we should spend all our time debating on what the correct definitions are. I think what is important, I think what is important is to look at the subject we are treating. Medical tourism, what do we need to learn? Because you see, we don't have to sit here and condemn medical tourism in totality. That would defeat the aim of our gathering, if I may say. There is something to learn from medical tourism. It is by people going out there that they see what is the current trend, what is the latest in certain areas. There is a hospital that is opened in Abuja today that is a child of medical tourism, and I can tell you. So the African Medical Center of Excellence that was opened on the 5th of June was given birth to as a result of medical tourism. So the chairman of Afro-Exim Bank goes to King's College London for treatment and gets impressed by the things he saw in the place and decides that this also should be in my country. And today, long story short, the African Medical Center of Excellence is now operational just by that medical tourism to UK that brought about the idea in the first place. So if he never made that journey, I can tell you that idea would not have been bettered. And today, the King's College London is running that hospital. They are the managers of that hospital. Because he quickly went into a pact with them to say, look, I like what I'm seeing here. I like the care I have received. Let my people also benefit from that quality of care. So I think it's about what do we learn from going out there, whether inbound or in country or outbound medical tourism. What do we learn? So that we can also continue to improve the quality of care in our own domain. I think that's most critical as far as I'm concerned.
Thank you so much. Thank you so much. Yes, please, can we give a round of applause to that? Now, thank you so much. And I also appreciate the fact that everybody, brought in their own definition to this, because it will shock you that a lot of people are seated here, but they're a little bit confused of, because what we know is reversing medical tourism and all of that. But how to balance all of these things now, that is why we're here. And that is why we will use the word bridging the gap. And that is why I intentionally, deliberately wanted us to open it up so that everybody will understand. And audience, you can bear me witness, will have a better definition now, right? All right, so we'll move on to the next one. So now, moving on to the next question. Now we understand what medical tourism is all about. You have given an example, Doctor, of King's College and other countries that are doing well. Now, the next question would be now is, what are those things some countries are doing better in healthcare that we need to also emulate here in Nigeria?
Thank you. There is what is called continuous quality improvement. And the truth is that you have to be deliberate. in implementing continuous quality improvement to inspire confidence in the system. All right? So countries are taking deliberate efforts in ensuring that year on year they are improving the quality of their healthcare service. Nigeria needs to learn from that. If you go to somewhere like South Korea today, South Korea manufactures more than 90% of the healthcare equipment and consumables that they use. By deliberately investing into that sector and improving, in the quality of the care that the population obtains. So there has to be some deliberateness. If you go to the ministries of health and the likes, you will find, strategic papers, the national plan, 2030 plan, and all of that is never implemented. I think the problem we have is we come to gatherings like this, we talk a lot, but we really don't implement things. We're not doing the right things. We're not hitting the ground running. So we need to inspire quality. We need to inspire confidence. And then we also need to talk about the things that we have. How did Nigerians hear about India? How did we hear about Saudi Arabia? We're not even advertising or promoting the services that we have in country, just like somebody had alluded to. You may have a good practitioner behind your backyard and you don't know about it. So we have to find a way to also talk about the things that we have. And lastly, we have to show leadership among the elite. So you remember when our former Vice President Osibanjo needed to have a knee surgery, he went to the Duchess Hospital in Lagos. So those are things. How many times did you hear that maybe the Prime Minister in UK or somewhere traveled to the US to have surgery? So our leaders should be able to patronize services within the country. By so doing, they inspire confidence. Thank you.
Wow. So 2 very key points that you mentioned. My next question will go to Elizabeth. So please, can you pass the mic to her? But so that you save time. Yes, but before then, two things you mentioned. You mentioned leadership, very important. It's important the leaders also patronize. The second thing you mentioned is policies. We'll gather to event like this, and then we'll talk implementation is problem. Even me too, I'm also of that school of thought that it's not just enough to organize a conference. If you organize a conference and you did not put step by step on how to put things implemented, then there's no need of calling for the next conference. Okay, so just like this is a 3rd edition, if there's nothing is done here, we should not even be talking about the 4th edition. Now, to you, sir, what are those things that you think, how, from your own point of view, you should be able to give us 1 or 2 points as this 3rd edition of the All Africa Medical is going on? After this, what would be 1 or 2 points you can say this is the next step to go in terms of implementation? Because this is all of us here together. This is all of us talking. Yes, you, sir. You can use this, sir.
All right. So if I'm the chief organizer here, and believe me, Usman is a friend, and we will talk after now, there are takeaways. We want to reverse outbound medical tourism. And therefore, there is something we can do, even after a conference like this. Why are people going out? That's purely on the supply side of services. Sometimes there is supply side gaps. In terms of technology, in terms of efficiency, in terms of personnel. Now, we have all these partners coming from diaspora, coming from overseas, Apollo Hospitals once approached me to say, send us patients and we'll give you 20% discount or 20% commission. And I said, no, I wouldn't do that. This is where we have the need. Come and set up here. All right? So we can, after a conference like this, if we want to reverse medical tourism or we want to bridge the gaps in service delivery, we can go into institutional relationships. Relationships that will then bring those services into the country rather than people flying out to receive those services. We have enough healthcare practitioners in country that can partner with the foreigners so that the services can be obtained locally by our citizens in a cheaper way. Because when you travel for medical treatment, the cost is enormous, with travel cost, hotel cost, the dependent cost, the persons that will travel with you. So I think at least one, is we can strike partnerships that will therefore bring those services into our country rather than people going out to seek them.
Thank you so much. Please, can we give Doctor a round of applause? I hope Mr. Usman is here. So one of the key points here is collaboration is the future of every business, every organization. So as a country, we should look into that. Thank you so much. I think it's important we're taking points at this point so that we don't come here, the 4th edition, and then we're still talking about what we have discussed this year. All right, so moving on quickly, Elizabeth, I want to ask you this question. I want to what are those things that, there's some countries that are doing beautifully well when it comes to medical tourism. They are doing well. They didn't just started one day. Rome is not built in a day, right? What are those things that you think they are doing? We can also learn. Some of them, few of them, we can learn and bring it into this country, and then to help also, the medical tourism we're talking about, the inbound we're talking about. So Elizabeth, please, can we hear from you? Thank you.
Okay. I think the one and only one I would say is, the patient treatment.
Patient care.
Yes, the patient care and treatment. Hospitals or facilities is not only about the machines and the medications, but the experience. Many people would always go back to a hospital because of the experience, because of how they were treated. Yeah. So, I'll give an example. Like if you go abroad for treatment, I tell you, from the airport, they are taking care of you. They would pick you from the airport, make sure you are comfortable, you're feeding, although you might pay for all of those things, but they ensure that they take care of you fully. I think we need to work more on the treatment, because I think for me, healing starts when patients begin to feel heard, they begin to feel seen. It's not only about the machines and all of that.
Wow, thank you. That was a very good one. For me, do you have anybody want to say something? Ma, do you want to add to that? Anybody? But I think, okay, you want to ask a question?
I want to.
Okay. Okay.
I want to add to that.
Okay, please, quickly.
Another thing we need to look at is effective supportive policy.
Okay, so number one is patient care. The second one is effective
supportive policy.
Supportive policy.
Yes.
What do you mean by that, sir?
What I mean is that if you ask me that are there supportive policies in Nigeria, policies that can support the adoption of medical tourism, we will say there are so many policies that are in place right now. But I added effective because if you have policy that are good enough, compelling policies that covers everything that we need to know about maybe adopting medical tourism, workforce
deployment. So I think you're not getting it right.
Yes.
What we ask is, there are countries that are already doing well. What are those things they are doing that we need to learn?
That's what I'm talking about. India, for instance.
Yes, you mentioned supportive policy.
Yes, there's a policy in India called Heal in India. Heal in India. Heal in India. Yeah, okay. It's a policy.
Okay.
And it's a supportive policy in the sense that they streamline their process of obtaining a visa, so that it will not really stress you. It's just like an invitation, medical tourism invitation card to India. So you can have everything done online, and within 2-3 days, the visa is out. But in Nigeria here, we don't have a health-specific visa. It's a general visa. If you are going for education, you are going for healthcare, and it takes many days. You have to go to embassies and all of that. This will discourage somebody. But when you have something that simplifies the process, somebody can easily say, okay, let me go to Nigeria. It's all about having good hospitals. But what have you done to encourage people coming in? Thank you.
Yes, sir. Yes, that's beautiful. I hope we're taking point. The first, you're going to talk. The first point is, patient care. The second one is supportive services. In fact, just to throw a light, my husband had someone that was supposed to visit Nigeria, an American that was supposed to visit Nigeria. So he sent a message to my husband to put things in place and everything. In fact, to the extent that we got an accommodation. Do you know that lady didn't get a visa to come to Nigeria? She didn't get a visa. Now, there were other things he was supposed to do and all of that. It took a very longer period of time. At the end of the day, the process was so much and all of that. And then that was how, some of these people don't have a lot of patience. And that was how she gave up. She said there was no point. There was no point. At the end of the day, she traveled to what's the name of this capital of Senegal? Dakar. She eventually traveled to Dakar and then spent like about 6 months with all the money and everything spent there and all of that. So I think that was also very, very vital point. That's actually the honest truth about it. So it's one of the things that we're going to document. Thank you. All right, so Ma, please, our time is fast spent. Yes, sir.
Okay, thank you. Very quickly, I will draw from my experience as the chairperson of the Interministerial Committee that built the African Medical Center of Excellence. What are the things that we could do? What are the things other countries are doing that we could do, we can learn from? One of the things that we must learn from is that while medical practice is a business, there must be a program or intentional support, to development of quality. Because the reason people go out is lack of confidence in the quality. Yeah. Now, if a doctor or a medical facility has to buy land, put their road and all of those things, it certainly becomes a problem. So what we did at the IMC is to first make sure that the government gives land to Afrexim Bank. Beautiful. We made sure that FCT put roads. We made sure that all the supportive infrastructure were put in place. So and that was where we came up with the concept of a medical city, which unfortunately has not seen the light of the day. So for us to create the kind of quality that we need, to inspire confidence, we need to be deliberate and intentional about supporting medical institutions locally. We shouldn't have situations where there's no light, we are talking and they take light. Now people have solar farms and all. So, and in addition,
the government point
yes,
of view.
so the government has to be intentional. And then the issues around regulation. My colleague here talked about continuous quality improvement. Yeah. The reason people go for medical tourism is they are not sure. Even when they know the services are here, they are not sure that it's the same thing. And that brings us to the issue of, what do I call it now? Tangible and intangible wealth. In a system where that if you go to America, the system is good. So even when you are going to a poor quality place, you go with the confidence that the system has done what it's supposed to do. So you are not, but here you can go to a hospital that has been duly licensed and you find out that it's not actually up to par, even when it is a public institution. And that's because the intangible wealth, that responsibility to regulate and to standardize is not there. Wow. So if we can do that standardization and regulation without fear or favor and maintain that quality, that if you enter a general hospital, by definition, this is what a general hospital is supposed to do, and you can get that service there, then people will begin to, and of course, the issues that have been raised here, the issue of lack of information. I was the director in the Federal Ministry of Health, and I could not understand for the life of me why, and at a very strategic level, why some things happen and we couldn't change it. The council says you cannot advertise. The minister said you must have information. So who is taking the decision? So the issues around governance is important. We need to, and then we're advertising Indian hospitals, we're advertising native doctors are advertising, right? Yeah, they can advertise on primetime news. Native doctors are advertising, traditional medical, and then the people that are doctors, health facilities cannot advertise. So what exactly? And the threats to advertising is so big that doctors are very cautious and mindful. So we need to really, again, look at our policies. And how government is taking this forward. Thank you very much.
All right, so thank you. Our time is already ticking. Thank you so much. That's another point to note. Very important point we need to put into consideration, advertising and all of the policy adjustment and all of that. Thank you. Yes, Elizabeth.
I will do myself a disservice if I don't. I'm a mental health advocate. I'm a coach. I'm a trauma recovery practitioner. And I think it is very important for us to pay attention to the mental health of our medical practitioners, our medical workers, because some of this aggression you get from the hospital is because a lot of them are even frustrated. And if the mental health, the wellness of even the people that work in these spaces is not taken care of or is not taken seriously, I don't think they will get the best out of
the way
them.
they behave at work.
Yes. And that is something, again, you spoke about what we can learn from the foreigners or from foreign countries. They pay attention to these things. You can tell them, oh, today I'm not feeling okay mentally, and they let you rest. They understand that there's a level you need to walk to and you need to rest.
Even good welfare package.
Exactly. So sometimes somebody's mental health is welfare package you get, and if you're able to sort these things, I think it will go a long way to help.
You're right. I agree with you. If school fees are not paid, how will you concentrate at work? These things are not taken care of. But these are very important. I mean, you see someone working very hard, and then if their children school fees are not taken care of, they're struggling to pay rent and all of that. I think it's also high time we start looking at this little welfare. You also and then affect the way people behave at work. So I think at this point we've been given 3 minutes to round up, but before we'll do that wrap up, there's we're going to use 1 minute to just touch it. There's something I have here. It's saying, how do we shift from medical evacuation to medical attraction? It's just 1 minute. The panelists will just, from medical what we have right now that we're calling, some of us are even calling medical tourism, is medical evacuation, and all of that. How do we shift it to attraction? I know we have said so many things, patient care and all of that, but just how do we attract at the state where we are right now? We shift from evacuation to start attracting immediately. Doctor, we'll start with you, sir.
I just make this point, because it's a burning point in my mind. Quality inspires confidence. Regulation also helps quality. So recently, the immediate past Minister of State for Health, Dr. Alausa, Dr. Alausa, put up a committee to look at the possibility of setting up the Nigerian Health Facility Regulatory Agency, and that's NEFRA. An agency that will be like what CBN is to the banks. And I was part of that committee. We've submitted our report. In fact, a bill, came out of the work we did, and that bill has gone through first reading on the floor of the Senate, because we want to have a healthcare facility regulatory agency that will bring about proper healthcare regulation across board. And when that happens, we'll begin to have, a quality mindset. It's going to be able to implement the standards of quality that will make us to reverse, begin to attract rather than evacuate people. Let me just stop there. There's no time.
Thank you very much. One thing we need to do, is to upgrade our facilities. The fact is that people go out because of quality, he has just said. Specialized, treatment. But if we have all these things here, and we don't have what we call fragmented wheels, meaning that Kaduna State is doing his own things differently. Another state is doing his own things differently. They are not united as one. There's no synergy. And at the end of the day, there's nothing like a PPP national desk. There's no health-specific PPP. Now, all these things work well in our country. So at the end of the day, what we need to do is to start having a central coordination, that is synergy. Bringing people together, carry them along, let the public sector carry them. The government, there has to be a policy to carry everybody along so that they can transform the health sector. And after that, they should go for international JCI accreditation because it makes them to gain visibility on the global healthcare. If you're not known, how can people come? So that is very, very important too.
Okay.
Yes, ma'am. Please.
Okay, so the answer is quality and confidence.
Yes.
If we have
Quality
confidence in the system,
and confidence.
quality builds confidence. So if we have confidence in the system, then people will, people will come in. And now, having quality, looking at the quality of care is a whole gamut of things. And we must not forget the issue of human resources for health. And I tell you, one of the last experiences I had, I tell this story everywhere I go because for me it was very critical. As a director, I was looking for, young, hot brain doctors, and medical workers. So in November of 2021, they sent me 11 doctors, MPHDs that, award-winning, and I was very happy. By January 2023, all but one had left. You see, I tell this story because they came as a cohort. They were not the only ones that left. They came as a cohort. The last one that was there, I was begging him, so he would get a scholarship. He's going to Harvard. I say, go, come back, because that was the only way to keep him. So the issue, we cannot have quality of care without addressing the human resource for health problem, and it is a serious problem. Now, when I read medicine, and maybe when he read medicine, there were 40% of us that were going to stay in Nigeria. I was one of them. Okay? Then there were 30% that would either go or come, depending on what. Then there were 30% that were just waiting to drop their pen and leave. Now, what has happened is that 30% that was waiting were already on their way. That 30% bridging the gap have joined them. And then the 40% of us who would have stayed are now being pushed out. Okay? So we must address that. Because when you go outside, half of the people that are treating them are Nigerian doctors.
Wow.
Trained in Nigeria.
Thank you, man. Thank you.
Thank you very much.
Thank you so much for that. Elizabeth, just so, because our time is already, our time is up, just as briefly.
Yes, I agree with them. Quality, and I'm going to add, we need to rebuild trust through quality, empathy, and trauma-informed practices. I think that will go a long way to help with the...
Wow, thank you so very much. We're going to be bringing this to a close, but before we wrap up, I would like to also just add one or two things. Just like what Dr. Ngozi had rightly said, the honest truth about it is that while we're talking about the few that remains, what about us? Some people are doctors, and then how many people are willing to take the journey to specializing and all of that? How many people are ready to take the pain, to go through what it takes to become a professional healthcare, service deliverer? So it is also very important that we start looking towards that direction in the area of our children and all of that. Pattern them very well. Even though people are leaving and we're having more people springing up, it might really not be noticeable. But the reason why it's very obvious is because they are few, and as they are leaving, the vacuum is getting wider by the day. Another thing again is that technology wise and all of that, nowadays things are made very easy in terms of business. Some of the healthcare facilities can reach out to, some of these Indians, people that manufacture this health equipment. You can actually get them on lease and then get to pay gradually. By the time you equip your hospital, people know that they can come, you make the money, and then you pay back gradually and all of that. And then I will also finally advise that we can't really fully conclude on medical tourism only by just discussing the aspect of the healthcare providers. What happens to embassies? They're supposed to be seated on this panel. What happened to hospitals? And what happened to hotels? What happens to HMOs? These are people that patient passes through them, and at the end of the day, they get frustrated. They are not well handled. People want to come into the country, they can't come in. People want to travel out, they can't come in. Even if they reach to the hospital and they get good services, what happens to that front desk person in the hotel that will just be talking to the person anyhow? All of these things are put together. When all of these things are encapsulated and put together. That is actually what makes medical tourism worth it. So, ladies and gentlemen, at this point, we'll be handing over the microphone. I hope we've been able to make little points that we didn't confuse you, right? Please give a round of applause to the panelists. They've done beautifully well. Thank you so much, sir, for your time.
Good afternoon, ladies and gentlemen. I want to use the opportunity to thank the organizers for making me the impromptu chairman of the event. I know the time is fast spent, so I won't waste our time. We'll basically go through the presentation. I am Lieutenant Colonel Amwe Majebi. I'm a consultant psychiatrist by training, and I am in the Nigerian Army. So I won't without wasting much of our time, while they were going through the debate, especially about the definition, I took my phone and I checked. I was trying to check whether there will be any international definition, maybe WHO or otherwise, for medical tourism. And the only one I could see, even the WHO specifically said that there's no specific definition for medical tourism. But CDC said it's traveling to another country for care. But I want to believe that our panelists have defined it today as when you move from your house, by Nigerian definition, moving from your house to another place for medical care. Basically, like Dr. Cole, they've defined it. He said specifically that the journey you make outside your place of abode to obtain health care at another destination. So the destination may be outside Nigeria, and it may be within Nigeria. So it may be inbound or outbound. But usually there's another part which caused the confusion, which was referral. Referral is a standard practice in medical practice, where you move somebody from one level of care to another one. So that, by definition, is not really medical tourism. It may actually be to an extent. So basically, I divide my summary into the questions as asked. Apart from definition, she talks about what are countries doing, because the topic of the conference is observe, learn, correct, and grow. And the only way you can observe is to look at what other people have done, or look at what they are doing, and then learn from it. So what are other countries doing based on the discussions we've had today? Basically, most countries that you will go for tourism, whether normal, just general tourism or medical tourism, the number one thing is that they have a policy, and policies that are backed by the government. You see, the whole country is organized with a focus to ensuring that the policy works. So we need policies that are supported by government. Apart from the policy, we need deliberate support for medical institutions. Deliberate support for medical institutions in every way, whether from the banking sector that will give loans, from the government that will make policies, make facilities available, make infrastructure available, everything. That's the second point. And then the patient care. Patient experience should be a wonderful experience from the point of entry into the hospital, even from the point of entry into the country to the point of getting to the hospital. It should be a wonderful experience. Nobody will come back if they have a terrible experience from the point of entry or from contact with you. So the experience of the patient should be a wonderful experience, just like you're going to, they treat you like a king anytime you're coming. That's the only way somebody will come. So those are what countries are doing that attract tourists to them. So the whole essence of all our conference here is to improve inbound medical tourism, people coming to our own country, just like we go to other countries. I must state that it is impossible for any country to completely take care of its healthcare without consulting with any other country. It's not possible. Even America, with all its experience, because it was stated, the reason why people go is not just because of quality. Sometimes costs, and sometimes you may even have an expert, and the waiting time is long. So one way or the other, people must do medical tourism, but let the balance of medical tourism not be too weighted against you. That's the whole essence of what we are trying to do. So what can we now do as a people, as a country? Number one is quality. The government must inspire confidence and quality. And for quality, there must be continuous monitoring and evaluation of what we have to ensure that it remains up to standard. Because if people come, once they get good experience, and next time they come, it's bad, nothing will be achieved. Then there must be deliberate investing. Just like I said before, there must be investments. The government must make sure that money is made available, either through loans that are very cheap, maybe single-digit loans or whatever. There must be very investing in providing finance, providing infrastructure, providing training to the medical personnel. Then implementation of the policies, just like one of our discussants said, policies, if you go to the Ministry of Health, policies are bound, but mostly not implemented. So government must make deliberate effort to implement policies. Even as we are leaving this place, the organizers must also make deliberate effort to implement what has been discussed. Then leadership by the elites, they must show example. Just like he talked about the former vice president showing example by going to the hospital in Nigeria to have his surgery. We must have leadership by example, and the leaders must show example to the country in order for us to have improvement. Then we must go into partnership, just like was said. There must be partnership between Nigeria and institutions like Saudi Arabia, Turkey, all these countries where things are being done well. We must partner with them for us to improve. We must partner with them, bring them in, whether to train our people, to bring facilities that we can use. Ultimately, the most important thing is we must form partnerships. But one thing I want to add to that is that not just partnership with people, other countries. We have a lot of Nigerians in diaspora doing all this work in America, UK. We should also look at partnership with people, Nigerians that are in diaspora, who are willing to come. There are many of them willing to come. If the policies are available, they will also come. So we must also partner with our own people who are in those countries, and I believe they will do a lot to help us. Basically, we must also address, the last but not the least is to address the welfare of the workers. You must address the welfare of nurses, doctors, if you want them to stay. If somebody's being paid 200, 300,000 naira and is offered 1.5 or 2.5 million, he will definitely leave, and you can't maintain quality without that. So the government must make deliberate effort to improve the welfare of the workers. Finally, my own take, in addition to all these things, that we looked at everything. They looked at broadly at everything, but I think they looked at financing and everything. I think one thing that was missing was financing in terms of health insurance for the people, because Nigeria healthcare is out of pocket mostly. Well, we must consider that to improve, because I've had a little bit of public health experience too. If you do not improve healthcare financing and then healthcare through insurance to help the people be able to source healthcare, you may only be talking to the elites of the country. Because what of the poor people in the village? Don't they need this kind of healthcare too? We must consider that. Thank you very much.
Thank you very much, sir.